Hi, I'm Kristen Palmer, and I'm at Pinehurst Surgical, of course, in Pinehurst, joined by Dr. Amelia Jeyapalan. How are you today?
Good. How are you, Kristen?
And I'm doing very well, and you're new to our area.
Yes, I've been here now about 6.5 months, but I was previously in practice in Pennsylvania and finally got to move where it was warm, thankfully.
I know, we forget that those really cold days up north can get you.
Very much so.
So North Carolina is a great place to live. We want to get into talking a bit about what you do. You are a general surgeon, but you specialize in breast surgery.
Yes, that's the majority of my practice.
Okay. Now, early detection, we hear this as women all of the time, and we have to pay close attention to it.
True. That's actually one of the most important things we can do as women. Breast cancer affects 1 in 8 women in the country, and it is the leading cause of cancer death in women. And while there's truly no prevention for it right now, though there's research into it, the only thing we can do is early detection. And that involves, doing monthly self-breast exams, making sure you get examined by your gynecologist or your primary care doctor once a year, and having your mammograms yearly once you're the age of 40 or older.
Okay, it's important also, according to you, doctor, that starting that baseline at 39 is pretty important as well.
The most important thing with the mammogram is that you need to be able to compare them from year to year. And so we get a baseline at 39 so that at 40 we have the 39-year-old baseline to compare it to. As the technology advances, it may not be as necessary to get that baseline mammogram, but it's still very important. And it's also very important to make sure that when your mammograms are examined, that they look at least 2 years, preferably 3 years prior when they're compared this year's mammogram.
Okay, that's good information to know. And a lot of women, we hear it all the time, everybody's a little bit afraid of that initial maybe baseline and certainly the mammogram.
Definitely.
And I know you probably...
While it is a scary process because you always worry, what if they find something? And then the other concern is it painful? Nowadays here at Pinehurst Surgical we do digital mammography, which means that there's not as much compression required, which means that the mammogram's actually a lot more comfortable than previously thought. There is still some mild discomfort, but not very much.
And it's far less
painful than anybody would ever think.
And also it's prevention of something that's far more painful. And,
true. And you need to have that done. If you wait and you wait and you wait till you develop a mass in your breast and you ignore it, then that could potentially be a cancer that could, the longer you wait, could spread and possibly cause it to kill you.
And that's why we're saying early detection is so important. But let's go on to the second stage. You, and I know now you also have radiology available here.
Yes, we have a radiologist in-house who will actually look at all of our mammograms, and if anything looks concerning, they will immediately schedule you for the next step, which is usually what we call spot compression views of a mammogram, which is we see an area in either breast that looks concerning, and we target the mammogram to that area and we look at it. If that doesn't show anything, 99% of the time it means you're fine. If it does show something, then we do an ultrasound to make sure that there's not anything there, or if the thing that is seen, the mass that's seen or the density that's seen is a cyst or something concerning. And based upon that information, we go from there. If there's a mass that you have on ultrasound that looks concerning, we then do a biopsy, and that's something we actually do here in the clinic. And what we do is pretty much, it sounds like it should hurt very much, but it's actually very simple. It doesn't take very long at all, and most patients are able to go back to work later on that day. We do an ultrasound here, we find the area of concern, and then we use this kind of special needle that has suction attached to it, and we basically can suck out the lump completely.
That's amazing, and that's one of the nice things about Pinehurst Surgical.
We try to do as much as we can here, so we can one-stop shopping. If you come to see us, we can get you taken care of for everything.
Okay, let's talk about some of the neat things that you're doing there, and I just found this amazing learning about this today. Really, the radiation treatment is cutting more than half by the procedure you're doing.
Yes. There's, if you have breast cancer, the way to treat it obviously is to do surgery in order to remove it. The longer it sits there, the higher the risk of the cancer spreading and causing further problems.
Right.
So most ladies, there's 2 ways you can do that. You can do a mastectomy, which is removing the whole breast, but that's really not necessary nowadays. We can do a lot of what we call breast conservation surgery, which is a lumpectomy, which is removing just the cancer and a rim of normal tissue around it to make sure that the cancer is out. The thing with that is that your breast is still there and it's already developed one cancer, so you have to treat it to prevent it from developing another cancer.
Absolutely.
And that's where radiation comes into play. There, you get radiation for lots of different cancers. For breast cancer, there's the old-fashioned way of doing it, which was you had it once a day, 5 days a week for 6 weeks, so it's a total of like 33 treatments. There's a newer procedure that we're doing here at Pinehurst Surgical in conjunction with the First Health Radiation Oncologist that's really not offered anywhere else. They're not doing it at Chapel Hill or Duke currently. And it's called a manocyte balloon. And what it is it's this lovely little balloon that we place into the cavity where your cancer was, in the lumpectomy cavity. And then we inflate it. As I said, it fills up till we fill up the cavity. It can blow up much larger than this if needs to. And then this part's in the breast. This part's sticking out the skin, and at radiation they take this part out and they take a little seed and they put it down this barrel and they leave it there for 15 minutes, and they do that twice a day for 5 days, and that treats your cancer.
That is something. That is something.
A lot, and it works wonderfully. Now, you know, there's certain criteria that you need to have in order to have it done, but most cancers with early detection are very small and are a candidate for this.
Okay, and that is one of the reasons we have to get early detection. 39, that baseline exam, 40 years old, a mammogram each and every year. They can do that here at Pinehurst Surgical. If they do develop a problem, then treat it here as well.
Very much so. We can take care of all that for them. And we're actually going to start doing breast MRIs for ladies who've had implants. So mammogram sometimes doesn't show us everything we need to know.
Well, that's good to know.
And so we're also starting to do breast MRIs here, which is a much better screening exam for ladies who've had who have breast implants or have had a history of breast cancer or are a gene carrier for the breast cancer gene.
Okay, well, more and more technology developing each and every day. Dr. Jeyapalan at Pinehurst Surgical is bringing that to our area. We thank you very much for that.
Thank you very much, Kristen.
What is your contact information?
My office number here at Pinehurst Surgical is 910-295-0264, and you can call that number and get an appointment, no problems at all.